Hi friends, welcome to Plexus Ortho. My name is Dr. Kannan Kumar, and today we're going to discuss one of the important topics for your NEET PG exam. So we're going to discuss about splints in the upper limb. It's very frequently asked in your NEET PG, FMGE and INICT exams. So you must have a thorough understanding of these splints in orthopedics use. So we are going to divide the topic into two halves, upper limb splints and lower limb splints, and we are going to discuss in a little bit of detail about each of these splints. So we must first understand what is a splint, what is a slab, and what is a cast. So what is splint? Splint is made of some kind of plastic material or aluminum or some kind of material which is used in the arm or leg or some part of the body to support or do some kind of specific function. So that is called as a splint, which is fabricated by using plastic or aluminum or some kind of metal. Slab is made of POP or plaster of Paris, calcium sulfate half H2O, and it's applied on one side of the limb or body or surface. So it is applied on one side, and therefore it is called as a slab. If it is applied circumferentially, if the POP is applied circumferentially all around the arm or leg or body, it is called as a cast. So therefore these three things you must be clearly able to differentiate, that is splint, slab and cast. You must be able to differentiate between these three things. Let's begin with the upper limb splint. Upper limb splint, the first one is called the aluminum splint. Aluminum splint is basically a material made of a thick aluminum sheet, and you can bend and mold and cut it into however you want. So this is basically an aluminum splint. So it is basically used most commonly for finger fractures, phalanges fractures, metacarpal fractures, thumb fractures. These are the various conditions in which aluminum splints are used. So aluminum splints are prefabricated long splints which can be bent and molded into whatever direction we want to fit for the fingers and thumbs, usually used for the fingers, thumbs and metacarpal and phalangeal fractures. So this is called as aluminum splint. Then what is knuckle bender splint? We have discussed this in previous videos. You know that the function of the lumbricals, which is supplied by the ulnar and the median nerve, is to cause flexion of the MCP joint and extension of the IP joints. So this is the L-shaped figure that you see. So if this is the hand, and these are the fingers, and this is the hand, this is the metacarpal, and these are the IP joints. So it causes flexion of the MCP joint and extension of the IP joints. So it forms a L-shaped thing. So lumbrical, L for lumbrical and L for L-shape. So when ulnar nerve or median nerve palsy occurs, clawing occurs. That is a failure of flexion of the MCP joint and extension of IP joint. So therefore you have the opposite, hyperextension of the MCP joint and flexion of the DIP and PIP joints. To counteract this or to do the function of the lumbrical, we use the knuckle bender splint, which bends the knuckle, flexes the MCP joint. It is very obvious in its name. So knuckle bender splint flexes the MCP joint and extend the IP joint, and patient can do some function, and it is more aesthetic or cosmetic to appear. So that is called as a knuckle bender splint, which is usually used in ulnar nerve or intrinsic muscle palsy of the hand to do the function of the lumbricals, which is flexion of the MCP joint and extension of the IP joints. So the next splint that we are going to see is called as turnbuckle splint. The turnbuckle splint is the splint which is used in correcting deformities. If you can see, there's a plastic splint. So you can see that there's a plastic splint here on both the arm and the forearm, and then you can see some kind of a metal piece attached to both of them. There's usually a nut at this end, and this slowly extends the forearm or flexes the elbow depending on what you want to happen. For example, if there is a flexion deformity of the elbow, you want to make it straight, you can use this splint with daily turns and slowly extending the splint. This is called as a turnbuckle splint. We have seen a turnbuckle cast in the spine, which also uses the same mechanism, principle, slow distraction or compression of the rod, which can correct the scoliosis in whichever direction you want. So this is called as a turnbuckle splint. This is particularly used in elbow flexion deformities. It can be used in the knee as well. Then coming to the aeroplane splint, this is the shoulder or axillary region, and then you have something, some kind of strapping at the level of the trunk, and then this extends to the arm and forearm. This can be used for brachial plexus injuries. Aeroplane splint is used for brachial plexus injuries. It is used for shoulder pathologies, shoulder injuries. So various pathologies involving the shoulder, tendon transfers, nerve transfers, brachial plexus injuries is where you use an aeroplane splint. Don't forget this. Then you have the Dunlop traction. Dunlop traction is basically historical in its nature. We don't use it anymore. It's very rarely used. It is basically used for supracondylar fracture of the humerus in children. Right? This is a complicated pulley system which is used for giving traction and reducing the supracondylar fracture. This is no longer used because it is very cumbersome. The newer techniques of using K-wires and other plaster techniques are far superior, and this kind of technique can also cause a compartment syndrome because of the constant stretching and the pressure. So, but these questions are still being asked in your NEET PG exam, and you should know the answer to it. And this Dunlop's traction is used for supracondylar fracture of the humerus. Then coming to the thumb spica splint. Thumb spica splint is basically a splint involving the thumb, okay, and this is basically for fractures of the thumb. Ulnar collateral ligament injury. What is ulnar collateral ligament injury of the MCP joint of the thumb called as? It is called as Bowler's injury. Bowler's injury. Acute UCL tear is called as skier's thumb or skier's injury. Right? An MCP joint chronic injury is called as a Bowler's injury. So when you have a thumb distal phalanx fracture, proximal phalanx fracture, or a ligament injury, or even a scaphoid fracture which has been managed in a cast and you want to change over to a lighter splint, in these conditions you use the thumb spica splint. So thumb spica splint is used anywhere in the radial border, all the pathologies of the radial border including the distal phalanx, proximal phalanx, collateral ligaments of the MCP joint and the scaphoid bone as well. Then you have the very important cock-up splint. It's very frequently asked in your exams. Cock-up splint is something used in the wrist joint. What does a cock-up splint do? Cock-up splint keeps the wrist in extension. When do you need wrist extension? When the wrist extension is not possible. When is the wrist extension not possible? In radial nerve palsies. So you use a cock-up splint in radial nerve palsies when you want to keep the wrist in extension. You don't want a flexion deformity of the wrist. Also, you have something called as the dynamic cock-up splint or dynamic extension brace. So here the fingers can flex, but the fingers get extended automatically. So this is called as a dynamic cock-up splint, and this is used in radial nerve palsies. Both the cock-up splint and the dynamic cock-up splint are used in radial nerve palsies. This is frequently asked in your exams, so you must be able to recognize this splint. So anything just short of the fingers up to the distal palmar crease is just called a cock-up splint. With these kind of rubber bands or some kind of springs attached to the fingertips is called as dynamic cock-up splint. Then you have the figure of 8 bandage. What do you use the figure of 8 bandages for? You use it for clavicle fractures. Most clavicle fractures can be managed conservatively. What is the most common fracture in an adult? It is the clavicle fracture. Most common location where it fractures is the lateral 1/3 and medial 2/3 junction. So this is the common location where the clavicle fractures. The treatment of choice is a figure of 8 brace. So this is called as a figure of 8 brace. This causes the forces that cause the clavicle to go up. The sternocleidomastoid pulls the medial fragment up, the pec major pulls the lateral fragment down. The figure of 8 bandage tries to correct these forces and then provides healing and provides stability to the fracture site. So this is the treatment of choice for clavicle fractures, figure of 8 brace for clavicle fractures. Then you have the gutter splint. Gutter splint is a splint that is used on one side of the hand. For example, if you have just a little finger fracture, you don't want to put a splint on the whole of the hand, and you can only splint the ring and the little finger along with the forearm, and this is called a gutter splint. It's called a gutter splint, which is used most commonly in the ulnar side of the hand for little finger injuries, little finger and ring finger injuries. So it is used on the ulnar side of the hand or the medial side of the hand, immobilizing only the little finger and the ring finger is called as the gutter splint. Then we have discussed this in detail. We have what is called as a mallet splint or a stack splint. What is a mallet finger? The mallet finger is an injury of the extensor tendon at the level of the distal phalanx. So when we draw a lateral representation of the phalanges like this, the extensor tendon goes all the way and inserts into the base of the distal phalanx. This is called as a terminal tendon, and this gets injured in case of cricket ball injuries and other kinds of sporting injuries when this gets ruptured, and therefore the patient is not able to extend his distal interphalangeal joint, and in this case we use a mallet splint. This is called as a mallet splint. This is also used for this splint is also used for DIP joint extension injury. And what is this called? This is called as a stack splint. So remember, both the mallet and the stack splints are used for mallet finger or injury to the extensor tendon insertion on the distal phalanx base. So mallet splint and stack splint. Then finally we have the sugar tong splint. Sugar tong splint is something that envelops the elbow joint on both sides and then comes and both aspects of the volar and dorsal aspect, the volar and dorsal aspect of the forearm are covered. This is usually used to prevent rotation. If you know, the rotation or supination pronation of the forearm occurs at the distal radial ulnar joint and the proximal radial ulnar joint. If you want to stop it, you have to either use an above elbow slab or a splint, or you can use something called as a sugar tong splint, which is very commonly used to prevent supination pronation of the forearm. It is also commonly used in children. So this is called as a sugar tong splint, where supination and pronation is restricted. Just a below elbow cast or a cast below the level of the elbow or a slab below the elbow will not suffice in reducing supination pronation movements. Supination and pronation movements can be reduced only with the help of a sugar tong splint or something which is going above the elbow. So that is called as a sugar tong splint, which reduces or restricts pronation and supination. So these are the upper limb splints. So let us just have a brief recap of what are these splints before we move on. The first splint is the aluminum. We discussed the aluminum splint. Aluminum splint is a prefabricated thin splint which can be molded for finger injuries, phalanges and metacarpal fractures. Then we have the knuckle bender splint, which is used for ulnar nerve palsies, ulnar nerve claw hand, which causes flexion of the MCP joint and extension of the IP joints. Then we have the turnbuckle splint, which is used for correcting deformities of the elbow joint. Then we have the aeroplane splint, which helps in shoulder injuries and brachial plexus injuries, tendon transfers and nerve transfers. Then we have the Dunlop traction, which is used for supracondylar fractures, and this is more of historical perspective rather than current treatment management. Then we have the thumb spica splint, which is used for ulnar collateral ligament injuries, distal phalanx and proximal phalanx fractures of the thumb, and the scaphoid fractures as well. And then we have the cock-up splint, which is used for radial nerve palsies. And then you have the figure of 8 bandage, which is used for clavicle fractures, and the gutter splint, which is used for little finger and ring finger injuries. And then mallet splint, which is used for DIP joint injuries, because injuries to the extensor tendon. Then finally we have the sugar tong splint, which is used in an above elbow fashion to restrict supination pronation. Thank you for hearing me out. Please do subscribe to the channel. We will come back with more videos. My name is Dr. Kannan Kumar and this is Plexus Ortho. Thank you very much.